Greetings from Indian Journal of Anaesthesia. I, Dr. Riniki Sharma, will be presenting a systematic review and meta-analysis published in the January 2025 issue of Indian Journal of Anaesthesia. It is titled Comparison of desflurane and sevoflurane as maintenance inhalation anesthetic agents for adult patients undergoing neurosurgeries. A systematic review and meta-analysis of randomized trials. Anesthesia in neurosurgery aims to maintain optimal cerebral perfusion pressure to prevent intracranial hypertension and enable early recovery for prompt postoperative monitoring and interventions. Desflurane and sevoflurane have been preferred anesthetics due to their low blood gas partition coefficients, facilitating swift recovery. Studies in normocapnic patients undergoing craniotomy have found no significant difference in the intracranial pressure between use of desflurane or sevoflurane, challenging earlier concerns about desflurane-induced vasodilation, cerebral vasodilations. But conflicting findings exist regarding recovery and cognitive outcomes. So this study aimed to compare the recovery profile, cognitive function, and safety of desflurane and sevoflurane in neurosurgical patients based on available randomized controlled trials. So the research question and objectives included emergence time, extubation time, recovery time, and the short orientation memory concentration test scores, time to achieve an Eldred score of more than or equal to 9, emergence agitation, incidence of PNB, incidence of side effects like shivering, desaturation, intraoperative hemodynamic instability, postoperative hypertension, tachycardia, bradycardia, pain, and convulsion in between the two groups. The trial was registered in Prospero, and these randomized controlled trials were included having patients with adults more than 18 years of age undergoing neurosurgery, including craniotomy, transsphenoidal surgery, or spine surgery, where desflurane or sevoflurane both were used as maintenance inhalation anesthesia. Pediatric patients, neurotrauma cases, and patients where one of the groups, studies where one of the groups were missing or unavailable full text were excluded from the study. Two authors conducted an extensive literature review up to 5th November 2024 using Scopus, Medline, Cochrane Library, and Euro PMC. They used various search terminologies like desflurane, sevoflurane, neurosurgery, and used Boolean operators or and and. The titles and abstracts of the retrieved documents were screened independently by two authors with duplicate manuscript removed using the Zotero software. Relevant studies in review articles, systematic reviews, or meta-analysis, but not located in the initial search, were also assessed to find if they met eligibility criteria. And disagreements were resolved through consultation with a third author. Emergence time was defined as the interval between the stopping of anesthetics and spontaneous or prompted eye opening. Extubation time referred to the time from stopping of anesthetics to tracheal extubation upon meeting standard criteria. The recovery time was the interval between discontinuing anesthetics and the patient's ability to recall personnel details, assessed by the short orientation scores recorded at regular intervals post extubation. The LDES score measured the recovery adequacy, focusing on physical responsiveness, oxygenation, and cardiovascular stability. The time to achieve this score post-extubation was documented. There adverse effects like emergent agitation, postoperative nausea, vomiting, shivering, desaturation, and cardiovascular abnormalities were defined during or after the surgery. The postoperative outcomes such as pain, convulsions, and recovery parameters were also systematically recorded, with efforts made to contact study authors for missing or unclear data. The risk of bias was assessed for using the ROM version 2 software. Dichotomous variables were analyzed using the mental Hensel technique to determine the odds ratio and associated 95% confidence interval. Heterogeneity due to diverse participant features and neurosurgical types was addressed using the random effects model using the I-square statistic. Subgroup analysis was performed based on the type of neurosurgery, which is craniotomy, intracranial surgery versus spine surgery, and country of origin for key outcomes like emergence time, extubation time, recovery time, and time to achieve the LRH score more than equal to 9. Publication bias was evaluated through the funnel plots, and statistical analysis were conducted using RevMan 5.4 version. The study's quality was assessed using the grade approach to ensure the reliability of systematic review and meta-analysis. So this is the PRISMA flowchart where a total of 5,691 articles were identified, which were screened and reports were retrieved and assessed for eligibility, out of which a total of 14 studies were included for systematic review as well as meta-analysis. This is the risk of bias assessment, where we can see that most of the studies had low risk of bias, whereas in some of the studies there were some concerns regarding the randomization process, the measurement of the outcomes, and the overall risk of bias. So this is the forest plot that shows comparison between desflurane and sevoflurane in terms of extubation time, emergence time, extubation time, and recovery time. And here we can see that desflurane had performed significantly better in all these three outcomes. This is the summary of the meta-analysis comparing desflurane and sevoflurane, where we can find that the emergence time, extubation time, and the recovery time were significantly lower with the desflurane group. The SOMCT scores at 15 minutes were significantly lower with the desflurane group. Similarly, the time to LRH score more than equal to 9 was significantly lower in the desflurane groups, along with the emergence agitation. So this is another forest plot showing the SOMCT scores at various time points, where overall it favored the desflurane group. This is the grade evidence table, where we can see that the level of evidence for emergence time, extubation time, recovery time, and SOMCT scores, as well as time to achieve LRH score more than 9, is low, whereas the rest of the parameters showed a moderate level of evidence. This is the chart showing publication bias. So this meta-analysis of 14 trials showed desflurane offered significant advantage over sevoflurane in neurosurgical patients, including shorter times for emergence, extubation, recovery, and achieving an LRH score of more than equal to 9. Subgroup analysis revealed statistically significant benefits of desflurane for craniotomy or intracranial surgeries, while spine surgeries showed no significant difference. The country-specific analysis also indicated that Turkey had statistically significant result across all efficacy measures, whereas India and Italy showed partial benefits in specific outcomes. Desflurane demonstrated better cognitive recovery post-anesthesia with higher SOMCT scores, aiding early detection of complications in neurosurgical contexts. Both desflurane and sevoflurane exhibited comparable safety profile with no substantial difference in the intraoperative or postoperative complications. The limitations of the study include a small sample size, geographic concentration of studies predominantly from India, heterogeneity among trials, and risk of bias in some included trials. Future multinational large-scale RCTs are recommended to validate these findings. Concerned about the desflurane's vasodilatory effects and its potential to alleviate the intracranial pressures in neurosurgical patients were found to be unfounded from this meta-analysis, as desflurane was found to be associated with faster recovery and comparable safety profile to sevoflurane. And unlike the other study, which broadly compared desflurane with multiple anesthetic agent, this study focuses specifically on desflurane versus sevoflurane and provides definitive assessment through meta-analytical data. So desflurane superiority extends beyond neurosurgical patients, as demonstrated by other studies in bariatric, pediatric anesthesia, and general anesthesia, all showing faster recovery compared to sevoflurane. So to conclude, the findings of this review and meta-analysis show that the use of desflurane as an inhaled anesthetic in neurosurgical procedures facilitates a more rapid recovery from anesthesia along with better cognitive function compared to sevoflurane. Thank you.